Good afternoon, everyone, and welcome back to my channel. Today, we will deal with some problems associated with summers in children. Summer is a big time for all the kids. It is a fun time for all the kids. But adults, what is the exact status? What is going on in their mind is what we are trying to look at it right now. In summers, children love to play all outside in the heat. They don't care about the heat, they just want to play. And subsequently, they encounter certain problems which we will discuss in short today. And it's a big time for the parents because the kids demand unearthly snacks at unearthly timings, and this is what makes very difficult for the life of the parents. Today, we will discuss in short about the 10 most common problems what the parents will face in with kids during the summer months. So, first and foremost is the dehydration. So, dehydration is nothing but loss of body water. During the summer times, the children tend to play outside and there is water loss from the body. That is what in medical terms we call it as insensible water losses from the body. This will lead to heat exhaustion and sunstroke. What is the difference between heat exhaustion and sunstroke? When the effect of heat takes a toll on the body, they become very weak because of the loss of water and salts from the body. This leads to tiredness, fatigue, and lethargy. This is what we call as heat exhaustion. And in sunstroke, they develop high grade fever associated with severe vomitings and severe dehydration. The only treatment is stay indoors, avoid the sun, and drink a lot of liquids and electrolyte solutions such as electrol. This will prevent heat exhaustion and sunstroke. And avoid playing between 12 to 4 in the afternoon, which is considered as the peak hour for getting this heat related problems. The second most important thing is the sunburn or eczema. Usually when the children tend to play outside, they release a lot of sweat and salts. The salts in association with the lack of moisture on the skin leads to a reaction which manifests as eczematous rash or skin rashes. The only treatment is hypoallergenic lotions that are usually prescribed by dermatologists. So a dermatologist opinion should be taken in this regard for those children who are having a tendency to develop these sort of rashes. Third important thing is what I am seeing personally in my practice is insect bites. So children tend to play in the parks a lot because of the greenery around, and parks usually tend to have 1 or 2 degrees lesser temperature when compared to the other zones of playing. So this tends to insects being very violent at that time during the summer months, and sometimes they bite the children, and this leads to insect bite reaction giving a redness, a swelling over the skin. So if it is mild to moderate, a moisturizer application would be sufficient, but if it is severe, please take the help of a dermatologist or a pediatrician to get some anti-allergic medication. During the heat, the viral reactions are also quite high, and the fourth important thing that I am going to discuss with you is the development of conjunctivitis. So conjunctivitis is also very common during summer months. This is basically because of either bacterial conjunctivitis or viral conjunctivitis. Bacteria and viruses, both of them can cause eye infection. The most important reason for development of eye infection is the children, they play in the sand pits, they play around, they don't wash the hand properly, rub the eyes or wipe the face for the sweat, and this leads to development of viral or bacterial conjunctivitis. Immediate consultation with a pediatrician is a must to give some soothing eye drops for the symptoms to come down. Children love to swim, isn't it, during the summer months? So a swimmer's ear infection and a swimmer's eye infection is also quite common, and this is my fifth point of discussion. A swimmer's ear is when the water goes inside the ear, it infects the middle ear canal and thereby forming pus. This is a swimmer's ear, and similarly we also encounter swimmer's eye, wherein the chlorine and other antiseptic powders that are used in the water, they tend to go to the eye and irritate the skin and irritate the eye. This leads to conjunctivitis. So ear infections and eye infections are very common for swimmers. So care should be taken to prevent these infections by use of goggles as well as earplugs and adequate cap to prevent swimmer's ear and swimmer's eye. We have seen a lot of children consuming junk food, outside food, and during the summer months, the food is not properly stored and the temperature will lead to rotting of the food very fast. So please try to avoid eating outside. And my sixth point of discussion is food poisoning and diarrhea. Many a times we see that the summer months have been a good time for the children so that they can have outside food, they can go out, they can eat street food, they can go to malls and eat in food courts, but we don't know the conditions where the food is being preserved in these things. So care should be taken to consume home cooked food only and avoid eating outside, because this leads to a lot of stomach infections, especially diarrhea. The only treatment is plenty of fluid, bed rest, electrolyte solution, and if there is fever, please consult a pediatrician nearby to get a prescription of an antibiotic if the doctor suspects a bacterial infection also. Decreased water intake leads to development of urinary tract infection, and this should be avoided at all costs. Please take adequate water, adequate liquids, fruit juices to prevent getting urinary tract infection. This is my 7th point of discussion, where it is easy for the children to develop urinary tract infection because of decreased water intake. So as parents, please take proper care to make the children drink plenty of liquids to prevent the development of urinary tract infection. Don't be in a notion that colds and coughs are not seen during summer. Even in summer, colds and coughs are seen very much. Viral flus and flu-like symptoms are also common in summer, and especially when the children are having a habit of eating refrigerated things like ice creams, milkshakes, kulfis, etc. during the hot summer months. The sudden temperature difference might lead to increase in the viral load in the nasopharynx and the throat, which will lead to development of throat infections. Ninth point is the most important thing, that is the development of prickly heat. Burning, prickly sensation of the skin, especially seen during the backs due to playing in the sun and the moisture and sweat giving a reaction to the skin. This is a very, very important thing. Leave the area dry, leave it open, and don't allow the sweat to accumulate much. 10th and the most important thing also that we encounter is development of asthma because of the increased air pollution and dryness during the summer months, as well as increased pollination too. So please consult your pediatrician to take adequate preventive steps for prevention of asthma and treating of asthma. So to summarize, the 10 most important things that we as pediatricians encounter in children are: first and foremost, dehydration, for which adequate liquids have to be taken; sunburn and eczema, for which a hypoallergenic sunscreen lotions can be applied after consultation with a dermatologist; insect bite reactions, where the children should avoid playing in the parks near to the trees and herbs; development of conjunctivitis, proper hand hygiene should be taken; swimmers' ears and swimmers' eyes, care should be taken to wear proper swimwear that includes a cap, earbuds and goggles. Please avoid eating outside to prevent the food poisoning and diarrheas. Prevention of urinary tract infection by taking adequate liquids, and if at all you encounter any colds, coughs and fevers, please consult your pediatrician. Prickly heat and the care against asthma. These are the 10 most important things that you should keep in mind as parents for these summer months. Thank you.